It is my pleasure today to host in this Ask the Author session Dr. Jason Samuels, who is a surgeon, a bariatric surgeon in Tennessee, who published recently a paper in Diabetes, Metabolism, and Obesity entitled Real World Titration, Persistence, and Weight Loss of Semaglutide and Tirzepatide in an Academic Obesity Clinic. So first of all, Dr. Samuels, thank you very much for agreeing to do this small conversation with me. And congratulations to you and to your co-authors for your paper. So it is my clinical practice to see daily patients taking these drugs. And as we know, the schedule, how they are administered in trials is not very flexible. And so I found very interesting to read your experience about it and to see how actually you do it and how actually I do it also. So first of all, can you tell us a little bit about the design of your study?
Absolutely. Well, first, thank you for having me, and I appreciate the very kind introduction. So, this is a single center retrospective observational study. Uh, the uniqueness involves the data set that we use. This data set arrives or is derived from a program called the Vanderbilt Weight Loss Bundle, which is a add-on to a private insurance policy that provides coverage for GLP-1s for up to 18 months at no cost to the patient. And so it ensures that the patient has access to medication, at least in terms of costs. It also provides us the ability to link a claims for when patients are filling the prescription with the EHR, which is somewhat unique. So we are quite confident when the patient receives the medication, beyond so if we were to rely on the EHR alone. And so we combine that data with the EHR data, and we wanted to look at both persistence and adherence to the recommended titration for specifically semaglutide and tirzepatide. And we wanted to look at some outcomes in terms of safety and effectiveness in terms of weight loss.
And so what are the main results of your publications?
Yeah, so we're certainly not the first to publish this. It's one of the largest sample size publications, particularly out of the United States. And our studies, our findings align closely with some of the studies that have come out of Europe, particularly a Danish and a UK population, in that we find that despite having really no cost to the patient and access to providers and a clinic that's dedicated towards obesity treatment, that patients still really struggle with following the recommended titration. And that also persistence is a challenge as well, particularly at a year. So specifically, we found that only about 50% of patients were still on the medication at 12 months after initiating a therapy. And based on the STEP 4 and SURMOUNT 4 trials, we know that patients who discontinue the medication are at a significantly high risk of weight regain. In terms of weight loss, we also found, however, that the weight loss for patients who do remain on the medication closely tracks with what was found in the definitive clinical trials that led to the medication's approval. And so when patients do remain on the medications in a real world setting, at least when prescribed from a clinic such as ours, which is obesity treatment focus, weight loss does closely track with what was described in the clinical trials, such as around 15 to 18%.
So I'm curious, why so many patients discontinue the treatment?
Yeah, I think that's probably the biggest gap in our knowledge still. From this data set, we're not able to specifically define why patients discontinued, and that's something we're actively working on now. And I know others are looking at that. Frequently, patients select to do that individually and don't necessarily communicate that with their physicians. And even if they do, it's not necessarily documented in the medical literature, in the medical chart. I mean, and so that's an important gap of knowledge that we really need to understand better to either determine, is it related to patients' understanding of the need to remain on these medications lifelong? Is it because they've reached an ideal goal in their mind or in the provider's mind, and so they're being recommended to stop it? It's an important gap that we really need to address.
So how do you translate actually this in your clinical practice, and how do you see this to be translated in a daily practice?
Yeah, so we are continuing to adapt to what is an ever changing environment around obesity treatment, and some of that has to do with education. And as we have more data showing the importance of persisting on these medications and the effectiveness, we can tell our patients how critical it is that they remain on these medications, or if they elect to stop the medication, that they communicate with the care team so that we can come up with an de-escalation plan to try and maintain that weight loss. And that's, I think, another critical gap. And that's something we're actively working on. I think there's a number of opportunities to maintain weight loss without GLP-1s that haven't necessarily been explored, but have shown some promise anecdotally. And that's something that we're actively working on as well.
That's a very important one, yes, because for many reasons, you don't want these patients to be on these drugs for years. And so effectively at one point, we have to transition that to other programs to maintain the weight loss. But thank you very much for taking the time to share your experience with us. Thank you very much, Dr. Sam.
Absolutely. My pleasure. Thank you so much.